Nearly 2 months into the coronavirus, COVID-19, vaccination effort, U.S. public health authorities have another challenge on their hands, making sure that people who've got their first shot return for their second one. Initial data shows that most people are coming back for their second shots. Data from the Texas Department of State Health Services showed just 0.3% of the 1.9 million people vaccinated thus far were late for their second shot, though another 7.5% are due. In Oregon, 5% of people who received their first dose of the Pfizer-BioNTech vaccination are late for their second shot, according to the state's public health data. But researchers have reasons for concern. Vaccines for other types of illnesses may give a clue about the challenge facing public health authorities. For the anti-shingles vaccine Shingrix, about 25% of people who get the first dose don't show up for their second dose, according to Dr. Paul Lafitte, a vaccine researcher at the Children's Hospital of Philadelphia. "You should be hounded that you are due for your second dose," he said. "It's not a given that everyone will be diligent about completing the vaccination process on schedule, despite the scientific evidence that a booster shot makes the coronavirus vaccines more than 90% effective at preventing symptomatic illness. The vast majority of people due for their second doses have gotten them, but there's some who haven't and are now past that 6-week mark when it is recommended," Chris Van Dusen, a spokesperson for the Texas Department of State Health Services, said in an email. "We definitely want people to get their booster doses on time because they are important to boosting immunity," he said. And as more vaccines roll out beyond frontline healthcare workers and older Americans, there is some concern the number of people failing to get their second dose could grow. Lafitte said that states, counties and healthcare providers will need to rely on a combination of newer technology, such as smartphone notifications, along with older tactics such as phone calls to be sure to get people's attention. "God only knows that retail pharmacies are good at this. The minute your prescription comes in, you get the message and you get it again and again and again," he said. The push is taking place against the backdrop of a public debate around whether to delay the second shots and focus on getting the first shots to as many people as possible. Rep. Ro Khanna, D. Calif, sent a letter this week to Biden administration officials urging them to consider shifting to a one-dose strategy, an idea that many experts including Lafitte say is ill-conceived because that's not how the COVID-19 vaccines were tested. "Immunization is weaker and may not last as long with one dose," Lafitte said. The guidance from the Biden administration and states is to complete the 2-dose regimen. A second dose is due around 3 weeks after the first dose for the Pfizer-BioNTech vaccine, and around 4 weeks for the Moderna vaccine, according to guidance published last month by the Centers for Disease Control and Prevention. But the CDC also said that the boosters could be given up to 6 weeks later if it were not feasible to get them sooner. The first doses of the Pfizer vaccine were administered December 14th, meaning the recommended interval just recently ended for a second shots for those patients. There could be any number of reasons people haven't received their second shots, experts said, and there's no good evidence yet on the letting reasons. They could include limited supply, canceled appointments, fear of side effects, forgetfulness or difficulty navigating appointment scheduling. Politics may also be a factor. Lafitte said he was concerned that some state governors were quietly de-emphasizing the second doses. He said he had spoken with public health authorities who were feeling the pressure to prioritize the first doses, at least in part because those numbers are often highlighted in the news media. He declined to identify the states. "There is pressure to get as many people vaccinated as possible so that your state doesn't look as worse as other states," Lafitte said. Not all states report data on how many people are overdue for their second doses, making it difficult for public health and medical experts to gauge the amount of catching up that states and healthcare providers have to do. Florida reported the number of overdue doses in January, indicating tens of thousands of people were late at the time. But the label may not have been meaningful under eventual CDC guidance because that was before 6 weeks had passed since the first doses December 14th. In any case, Florida eventually stopped reporting the number. Jason Salemi, an epidemiologist at the University of South Florida, said it was difficult to know yet whether states are struggling or how concerned to be. He said he was encouraged that, in recent days, Florida has been administering more second doses than first doses. "It would take a little bit deeper investigation to know whether we should be worried about this," he said. "I'm hoping that they're at least collecting that information, analyzing it and following up." Florida's state health department did not respond to a request for comment. Vaccine experts are concerned that people may not realize that one dose of the Pfizer or Moderna shots won't be enough to fully protect them against the virus. Lafitte specifically worries that getting only one dose of the Moderna vaccines, or waiting for many months between doses, might make it easier for the coronavirus to mutate. One dose might make it easier to create variants, because the virus is wounded with a lesser immune response, not killed, he said via email. And when wounded, it has a chance to escape. This article was originally written by David Ingram for NBC News. Timing of second COVID vaccine doesn't need to be exact. Just get it, experts say. It's okay if you can't get the second dose right away. But experts strongly recommend getting it as soon as you can. The slow rollout of COVID-19 vaccines, including delayed deliveries, states receiving fewer doses than expected and difficulty scheduling appointments, has led to some consternation that people may not be able to get their second dose within the prescribed time frame of 21 or 28 days. While potentially worrisome, public health experts across the country say there's no cause for concern. Full coverage of the coronavirus outbreak. The Centers for Disease Control and Prevention, national pharmacy chains, infectious disease experts, and doctors on the front lines of treating patients say that there is some wiggle room for that second dose, while also emphasizing that it's still essential to get fully vaccinated as soon as possible. The second dose should be administered as close to the recommended interval as possible, the CDC said in an update to its website Thursday. However, if it is not feasible to adhere to the recommended interval, the second dose of Pfizer-BioNTech and Moderna COVID-19 vaccines may be scheduled for administration up to 6 weeks, 42 days, after the first dose. Reena Shah, Group Vice President of Pharmacy Operations and Services at Walgreens, which plans to administer doses at its stores across the country, said that patients can receive the second dose as long as it follows the immunization window, meaning that the second dose is given no earlier than the designated time frame. We encourage patients to schedule the second dose appointment as close to the earliest appropriate date, but a bit after is okay, Shah said. That runs counter to the official guidance from the Food and Drug Administration and Pfizer-BioNTech and Moderna, the drug makers behind the two vaccines currently available in the U.S., which states that 2 doses, given at specific intervals, are necessary for maximum protection. For Pfizer, that interval is 21 days, for Moderna, 28 days. Those time frames come from how the vaccines were administered in clinical trials, meaning the only data available look at how well the vaccines worked when given either 21 days apart for Pfizer, and 28 days apart for Moderna. But the body's immune response doesn't expire after a set interval. Your immune system is really smart, said Dr. Buddy Creech, director of the Vanderbilt Vaccine Research Program at Vanderbilt University Medical Center in Nashville, Tennessee. It doesn't forget what it saw the first time, he said, referring to the first vaccine dose. Creech, who has overseen clinical trials for Moderna, said the vaccines should work as expected, even if the second dose is delayed a month or more than what is recommended. Do not panic. Even if it's 4 weeks, 6 weeks, 8 weeks before you can get that second dose, it's fine from an immune system standpoint, he said. Like any defense mechanism, if the immune system sees something once, it may be prepared the second time, said Dr. Bruce Wiley, a professor of health policy and management at the City University of New York. If you're exposed to something a second time, it tells you, hey, you've got to treat this seriously. That could happen even if the second dose was given as much as a year later, said Dr. Diane Griffin, an infectious disease expert at the Johns Hopkins University School of Medicine, though there is no data showing that giving the second dose that much later would lead to the 95% effectiveness seen in the clinical trials. The main reason for the booster is to get the immunity up to a high enough level that you're confident that you're protected, Griffin said. Still, Griffin stressed the importance of getting fully vaccinated sooner rather than later. People may think that they're protected because they got 1 dose, she said. While the first dose does offer protection, there needs to be an emphasis that a second dose is necessary for full protection. Lee agreed, adding that the better protected any individual is, the better it is for others around them, too. If other people are protected, the virus can find fewer opportunities to spread, he said. Correction, January 21, 2021, 4:51 p.m. ET. A previous version of this article misstated the number of days recommended between each COVID-19 vaccine. The interval for Pfizer is 21 days, not 28, and the interval for Moderna is 28 days, not 21. This article was originally written by Erica Edwards for NBC News.